Sarah Galuli spends her days walking along the trails of her Port Moody neighborhood. It's a way to cope as the 40-year-old mother of two grapples with a stage 4 cancer diagnosis.
My 4-year-old doesn't know what's going on, but my 10-year-old is sharp as a tack. She gets everything. She listens to everything. We try not to give her too many stats or anything, but she gets it. She knows that it's a big deal.
Last year on July 1st, Galuli was told she had breast cancer. A lumpectomy was scheduled July 28th. Following the diagnosis, she asked for a CT scan, a PET scan, and a Ki-67 marker for tumor proliferation. She was told she didn't need them.
And I always felt like whenever I was in front of a medical professional, it was amazing and I was taken care of. It's when I left that the silence was deafening.
2 months later, she saw her oncologist, who ordered the tests she had initially asked for. By November, the cancer had spread.
I was so saddened by it.
Galuli believes if these scans had happened earlier, things may be different. She brought her story to the legislature on Wednesday, her 10-year-old daughter by her side.
Pretty special to not only try to provoke advocacy, but also to show my daughter that it's still possible.
She's frustrated with how long she waited and is pleading with those in power to do something about it. The province says it's added hundreds of new healthcare workers, but there is still strain on the system.
And we're going to continue to work to drive down those testing times, treatment times, to ensure that people get the cancer care that they need.
A group that represents those working in diagnostic imaging says there are fewer than 30 PET technologists in BC.
That creates a very terrible bottleneck and only results in challenges for patients and clients, leaving our already stretched out, already burnt out workers trying to mitigate that challenge as best they can, but with very limited resources.
For years, Doctors of BC has asked the province to develop a provincial waitlist database.
So the specialists can manage their waitlists better so that they can make it more streamlined.
Since speaking out, Galuli says many have reached out with similar stories.
But one of the first things that I told my husband when I got diagnosed is I want to be the change. I want to change the medical system. He's like, do it, Sarah. We will all support you.
Isabella Zavarisi, CTV News, Port Moody.